That's a very high number and alarming. And for every suicide, there are 29 attempts. So again, I will repeat that. For every suicide, there are 29 attempts. Men die by suicide 3.53 times more frequently than women. And in New York, the rate of suicide is 8.1 per 100,000 people compared to the national rate of 14 per 100,000 people. I believe this is making actually New York the lowest, the country with the state, I'm sorry, the state with the lowest suicide rate, followed by Jersey, in which they have 8.6 per 100,000. All right, so mental health and suicide attempts in the Muslim community. So unfortunately, through my research, over the summer, I've done a lot of research, and it was actually disheartening to find that there wasn't much research done on suicide within the Muslim community. And why is that? There's just not a lot of data, but it is moving forward so let's look at this here, some of the statistics. So Islam is the third largest religion in the US, and there's about 3.45 million Muslims, I'm sorry. And there are over 750,000 Muslims in New York, and this is making about 8.9%, about 9% of the city's total population. Mental health illness and suicide are highly stigmatized by Muslims due to cultural reasons. So again, you guys will hear this in a bit, but Islam is actually Islam focuses on mental health, and mental health is very, very important and crucial within the religion itself, because there's an emphasis on having the body, mind, and soul in tune and taking care of the well-being of all three aspects in order to be your best self. But unfortunately, again, due to culture and due to many people's backgrounds, sometimes stigma comes in, and it's projected. Now, there was a recent research finding from JAMA Psychiatry Journal, and one of their findings was that self-identified Muslims were 2 times as likely to attempt suicide compared to other religious groups in the US. And it was to be honest, it was very surprising to hear that, just because Islam, again, is a very friendly, positive, and promoting mental health. And so to see this, it was alarming in the sense that it was an eye-opener that something is happening in the Muslim community, not only in New York, but in the US, where this needs to be addressed, because we need to find the root as to why people are attempting suicide and how we can help. So a little bit about mental health and Islamic history. Again, I'm not a scholar in Islamic history, and so I don't know too much about it. But according to some of the research that I found, there have been traditional healing centers. So, for example, in the past, there has been usually these traditional healing centers were named Dar al-Shifa, which means in Arabic, which means like the place of healing, or Maristan in Farsi. Farsi is another language. And the purpose was to just incorporate those Islamic principles for healing, and these principles were treatments for the body, mind, and soul. And essentially, there's a specific organization called Maristan who aims to lead like professional clinical care, education, research basically in advancing holistic mental and spiritual wellness. So kind of putting all of that together. So actually, Muslims in Islamic history, Muslims were one of the biggest contributions Muslims have provided to the global community was creating these traditional centers and where the people are attended and cared to for their spiritual and mental well-being. So perhaps a lot of you didn't know that. I certainly didn't know that until recently. So again, there's also another book called another author actually who talks about, his name is Al-Balkhi, and basically he explains symptoms and treatments, giving advice on preventative measures and how to return the body and soul to their natural healthy state. And basically, he does this by having a keen understanding of the human condition and the medical nature of the human emotional state. And this was recently within the 20th century. And he brings in a lot of insights and in both from both the spiritual aspect and the psychologically emotional and mental components and aspect. All right, so QPR sessions. So QPR sessions are basically, again, question, persuade, refer. It's a suicide prevention workshop, and basically it is essentially designed to inform and educate the community on the signs of a suicide crisis. So again, QPR instructors are not therapists, they're not psychologists, and they're not psychiatrists. They're certified, trained individuals who will provide hope, motivate at-risk individuals, and train to teach people how to identify signs of a suicide crisis. So essentially, after each of these QPR sessions, you get to receive a certificate stating that you're a gatekeeper. So who's a gatekeeper? A gatekeeper is anyone in a position to recognize a crisis and warning signs that someone may be contemplating suicide. So again, question, persuade, refer. So there's a lot of, there's a lot of components to each part. So with question, again, there's a less, it's basically accent, right? So a less direct approach is, for example, if you ask someone, have you been unhappy lately, right? That's a less direct approach in terms of questioning. A more direct approach may be, have you ever wanted to stop living, right? So that's an example. With persuade, the biggest thing is to listen, right? So don't rush in your judgment or your condemnation. Also, the goal is to have the person agree to get some help. So when we're in the persuade stage, your goal is to have the person get help. You're not there to solve their problem. You're there to help them get the help that they need, right? And an example is saying, for example, like, will you come with me to see a counselor, right? I do want to note that refusal to accept, if a person refuses to accept help, it does not mean your QPR has failed. That is very important to take note. And persuasion does work best when you focus on healthy solutions to problems, not the suicide solution, right? And persistent in statements that suicide is not a good solution and suggests better alternatives. Better alternatives can be found. And essentially, like, show respect, right? Let them know they matter. Let them know you genuinely care. That is very, very important. And finally, refer, connecting the person with a competent local mental health professional. So that's the last step, in the sense where you've talked with the person, you've listened, and the person did agree to accept and further help, professional help. When we kind of look at the clues, so VBS, verbal, behavior, and situational clues, right? So you all may be thinking, well, how do I know someone is contemplating on suicide, right? How do I know someone has attempted suicide? Well, here are some clues that I can help you all with. Direct verbal clues, right? So if someone says, I've decided to kill myself, right? Or someone says, I wish I were dead. Those are all direct verbal clues. And indirect verbal clues is, I'm tired of life, or I just want it out easy, or my family would be better off without me, right? And actually, one of the biggest myths that people have usually, and it was funny, it was very interesting personally to see Dr. Garner conduct the QPR sessions, because she would always have the question, truth or myth, right? And one of the questions were people who contemplate on attempting suicide do not think about their loved ones. And a lot of the times that's a misconception, where people think that people who are attempting suicide or contemplating on suicide do not think about their loved ones. They do. They wonder, how would their loved ones, their lives be if they weren't there, right? So approaching someone and just saying, like, that's selfish of you. What about your mom? What about your dad? of course they've thought about their mom or their dad, right? So again, being mindful and listening instead of projecting your judgment onto them. Some direct verbal clues, some behavioral clues are, for example, purchasing a firearm, or making funeral plans, or stockpiling pills, or relapsing into a drug or drinking habit when they've already recovered, right? Or giving away prized possessions. That's a very, very important one to take note, because that is one of the biggest signs as well. And it's situational, sudden rejection by a loved one, right? Recent move, especially like if it's unwanted, or sudden unexpected loss of freedom. So incarceration, for example, right? How many incarcerated individuals, contemplate or attempt suicide? So these are all factors that impact. These are all clues that can indicate someone is attempting suicide.
Mariama, I'll
Right.
give you about a minute to wrap up.
Okay, I'm almost done.
No problem.
So these are some of the examples of the suicide prevention workshops. So we had it with the Mass Youth Center. We had it with the ICNYU. And these were all beneficial, and these are some of the training materials. So these are some pictures. Next, please. All right, some feedback from people. So, Mass Youth Center specifically said, thank you so much for being so open and proactive in bringing this incredible workshop to our community members. We are honored that we are the first religious organization you've done this training with, and with no doubt that you'll be a great resource to countless others here in New York. So again, this is the first and Mass was the first organization a friend of mine has brought their QPR workshop to a Muslim community in New York. And other people have just said, this has been a great learning experience. Next. So finally, I have one more QPR session coming up with Masjid Sadiqi, and it's a mental health plus a mental health in Islam panel. So I'm really excited for that. That's going to be on the 20th. So that's next Friday. And that will be in person. All the other QPR sessions have been online. So this QPR session will be in person, and I'm super, super excited for that because it will be both the suicide prevention workshop and a panel discussion about the mind, body, and spirit. So kind of incorporating and incorporating the cultural competence within the Muslim community, so we can understand mental health from a perspective of a religious stance and a more yeah, see you next week, in a more professional sense. Next, and I believe that's my end as well. Yeah, these are some sources. Next one. These are some hotlines if you want to screenshot really quick. And that's all for now. Thank you.
Awesome. Thanks so much, Mariama. Very informative. We'll hop on over to Elizabeth now. And I think just we'll leave Q&A to the end. But please, if you have any questions for Mariama, please do drop everything in the chat. But great job. And I'll hand it over to you, Elizabeth.
Hello. Thank you. All right. Can everyone see my screen? Okay.
Yep, can see it.
Perfect. All right, just want to. There's something. Oh, I apologize. There we go. So can you see? Okay, perfect. So I just want to say, good evening to everyone. Thank you for taking the time to come to see my presentation, the culmination of my 10 weeks I worked with diversity and diabetes. I'm extremely excited to talk about the See Color campaign and show what I did to aid the creation of the marketing plan. So let's begin. I'll just give a brief synopsis of who I am and the organization. Oh, didn't need to go that far. There we go. And who I am. So my name is Elizabeth Seymour, and I am the Diversity and Diabetes Research Intern. I did many activities and projects throughout my time with DID, but the main focus of my time was the See Color campaign for the diversity and diabetes. So who is DID? So they're an amazing organization that does advocacy for increasing representation in healthcare professionals, increasing knowledge of diabetes treatment options, and technology with people of color living with diabetes. They also create awareness, provide education, and develop solutions in regards to the lack of diversity in diabetes care, management. And just this organization does so much, and I can honestly do an entire presentation on why this organization is like so amazing and very much needed. So this is just like quick little table of contents, what to expect, what I'm going to be talking about today. So this is the timeline of the See Color campaign from when I started on it in June 16th and until the eventual launch of the campaign, which is next on September the 16th, 2021. I created and presented my successful campaign research and had a brainstorming session with Quisha and Casey. They're the organization, they're the creators of DID, and just to bring the campaign to fruition. And just a little fun tidbit, I created 30 social media posts for the campaign. So what does See Color mean? It means to see the entirety of a person when it comes to race, culture, ethnic background, and for the purpose of the campaign, and also within the context of diabetes. The objective of this campaign is to highlight cultural competencies and making sure they're not ignored, overlooked when people who are at the cross-section of race and diabetes. It's important to know an individual's racial identity, how it can contribute to their patient managing their chronic conditions. And also just another plug, this campaign will officially start on September 16th on various social media platforms, and it will debut at the People of Color Living with Diabetes Summit, which is going to be held September 16th through 18th, where the theme of the year is Voices of the People. This will be a continuous campaign, and it will not end. So hopefully just having that interaction with one another, the campaign won't end. And there will be educational materials and other resources developed to go along with this campaign. We encourage everyone to join the discussion about race and diabetes. So this slide discusses the blueprint of the campaign. I'm just going to turn off my camera real quick. My internet's a little slow. All right. So this is targeted more towards healthcare professionals who want to create a cultural competent environment for their patients. It's also intended to cause individuals to be more reflective and self-aware of their thoughts and interactions with others. Since this is a social media campaign, it's international, meaning anyone around the world can participate and work with. So in order to bring this campaign to life, I created a cross between a persona and an empathy map to better see how our target demographic would interact with this campaign. All right, so this is one of the first personas I created. This individual's name is Ember Nieves. She is a nurse who believes that since she has a good rapport with her Black coworker, she can't be racist and that she's a good person. She stumbles upon the campaign and feels uncomfortable immediately when race is mentioned. Not only that, but she thinks it's unnecessary to bring race into health. Whenever she bakes cookies for everyone for the home dish, everyone gets a cookie regardless of race. However, she stays because of the helpful information regarding the diabetes and follows all of DID's campaign and all the platforms available to prove herself that she's not, racist. After seeing the conversations being held about race and diabetes, she realizes that by eliminating race from patient care, she's actually part of the problem. Every post brings new information that she is happy and excited to learn about and use the information in her professional and hopefully in her personal capacity. So for the next person, this individual's name is Sam Young, currently earning a degree in healthcare and loves to volunteer. Her grandfather passed away due to complications resulting from diabetes, and a fire was lit. While she couldn't help her grandfather, she is determined to be informed. She is constantly trying to find more information about diabetes so she can be a better assistant at the hospital. She realizes that people of color are having more issues and keep returning to the hospital where she volunteers. While on break, she sees the See Color campaign and starts to connect the dots. She begins talking to patients about how to advocate for themselves with their doctors, and she speaks with her supervisor about how they can have a watch party on See Colors, like physical activity events or cooking demonstrations with their patients. Sam would interact with this campaign as she is a person of color and has a history with diabetes. She generally just cares and is passionate. If we come across a patient like her, a person like her, we would want to make her an ambassador for the organization. Okay, so this is Ethan Eric. He's the classic pull yourself by the bootstraps type of individual. He's earned straight A's since primary school, and he works odd hours while going to school full time to be a physician's assistant. Furthermore, he doesn't consider race to be an issue in his life, and therefore it's not considered a real issue in anyone's life. He feels that focusing on race is unnecessary, and that as long as you work hard, you can do anything. So what's his interaction with the campaign? This is exactly who we are trying to reach with the campaign. He does not believe in race is an issue. However, after looking at all of DID's content, he realizes that it does play a bigger part than he realized, and he is now making sure to apply a more holistic form of care moving forward. So another individual I created, Arnold Kingster, has been the headmaster of a prestigious medical school in South Africa for the past 3 years. He's extremely hard on people of color and believes that they need more discipline. Over time, he's gained the reputation of the spirit destroyer when it comes to people of color at the school. The school historically has had a diversity rate of 35%, and during his time, it's dropped to less than 3%. He attributes this to people of color just being lazy and they want to be coddled. What are his outcomes possibly after interacting with the campaign? So his outcome is entirely up to the headmaster, Arnold Kingster. He may scoff at the campaign and continue his reign of terror, but we hope that he is willing to look at his metrics and use that as a motivator to look into the campaign and definitely reestablish a diversity rate. So caution. Warning, a wild troll has been spotted. Up ahead, treat, with caution. This is at _troller08. We know little about them. They are a firm believer of all lives matter and colorblind. They also love to play devil's advocate. They think that being white is the most difficult thing in today's society and that people of color have no idea what being oppressed is like. The interaction with this campaign has caught their interest for all the wrong reasons. They have no interest to learn about what is being said. So when coming to contact with this individual, there's really only two things you can really do. And that's either deal with them in a professional manner and using the time to educate the troll. And the other option is to just simply block them. It's fast and less time consuming. With either option, you gain respect of your audience when interacting with trolls. All right. So as I said in the beginning, DID does a lot to decrease the inequities in healthcare and poor health outcomes in individuals and communities of color with regards to diabetes. This campaign is important because healthcare providers and clinicians think that they're being helpful when they say statements like, I don't see color or I'm being colorblind. As a result, this is actually hurting the patient by not looking at the totality of the person. This campaign aims to educate individuals at things like that. The campaign is saying that in order to provide the best care possible for these patients, at the intersection of race and diabetes, we have to see color. By disseminating our message on all of our platforms, we can have the opportunity to invite conversation and growth. How we will know this worked is comparing the interaction before the campaign versus during the campaign and tracking the level of activity every 2 weeks. So this can be done by checking the various hashtags that we have placed on social media. So these are the hashtags that we have for the campaign. And again, be sure to look out for it on September 16th. There are general social media recommendations. The DID organization has very diverse volunteers and ambassadors that can disseminate the information. So definitely utilizing that to the best of their ability. Also using allies and social media influencers to share the posts because they genuinely care about the cross-section of race and diabetes and understand the necessity of the campaign. And the messaging type of the campaign will focus on benefits of the call to action. So in this case, seeing and caring for the whole person and being able to provide better holistic care. What you can see with the two images below is that one image is in black and white while the other one's in full color asking the same question. Can you pass the pink and blue capsule? When you try with the image in color, it's obviously easier to accomplish the requested task. When trying the same task with the black and white photo, it's impossible without guessing. You have to see color in order to see the full picture. These pictures, in my opinion, encapsulate the whole message of the See Color campaign. So for the dialogue, this one's going to be focusing on Facebook and Instagram content, making it appealing and interactive. for the dialogue, create a post about the hashtag See Color campaign and make sure people comment about diversity and diabetes in their community and why this topic is so important to them, and creating resources or videos that inform individuals on diabetes awareness and the impact of people of color. For Instagram, just to make sure that the story is permanent so people can still have access. And then for the action, I would definitely recommend going live more so in the beginning of the campaign and doing it intermediately later. This way it shows the human side of the organization, also showing the work that you've done to new people, to the organization. And when doing physical activity, it becomes more attainable for those, watching. I also recommend having like a cooking class live and posting content afterwards about recipes. This would just encourage people to learn to cook using healthy food or alternatives, and highlights new recipes and ones from different cultures that are priced, well. Which brings me to my next topic, promoting healthy ethnic food. This would encourage healthy food and cooking and education as well. Building and encouraging community garden usage and people of color communities that are, food deserts. This also encourages self-sufficiency, and this would also draw attention to food deserts that can be, at the center of race and diabetes. This would also just be a fun educational activity that results in sustainable agriculture. So make posts about these gardens and have others send in their stories or growing their own food. Example, like posts about color of the world using vegetables in different colors used in different cultures. And also, just in the last little recommendation, having a scavenger hunt showing the diversity in the world. For example, give 5 examples of how you see color in the world. So it's just interactive, appealing, and especially with the content, they show pictures. It just makes a nice little smorgasbord of information for the campaign. Let's see. The LinkedIn activity is, to create posts about talking about how important the cross-section of race and diabetes is, using this platform to promote all activities and use research found, use this to connect with other organizations and professionals in healthcare. And then the Zoom content. So the Zoom activity focus is mainly hosting a webinar by people of color, medical professionals, and researchers about diabetes in these communities. Also making sure that this is a safe place for this conversation by having a moderator and a password lock to avoid the meeting, to avoid Zoom bombing. Right. And YouTube, definitely utilizing that. So the activity would be hosting a conversation on YouTube. This can be accomplished by making a video essay about POC communities or sponsoring popular YouTube creators to speak about these issues. So this is the social media post schedule that I created for the first 2 weeks of the campaign. Just, give it a little bit of organization. Again, this campaign is going to be continual. So this is just for the first 2 weeks. And this displays all the objectives of the social media post. This image was split in half solely for the purpose of visual purposes, so you could see what it says. And then last but not least, call to action. So how do we get people to interact with the campaign? Having a big event or discussion once a month for a week discussing race and diabetes. For example, talking about mental health, engaging in physical activity, and so on. After attending a monthly event, they can sign a pledge and get a certificate or get a different certificate for every monthly topic discussed. And finally, people who have a genuine interest in the topic will naturally find and like this topic because of how it impacts them in their life. Again, targeting people who naturally feel comfortable when they don't see race when taking care of a patient. Kind of like Arthur Kingster, people have a choice to interact with the campaign or ignore it. Also like Amber, people like to not realize their tendencies and can be hurting someone. We can do everything in our power to get people to go to this campaign, but it's their choice how they choose to interact with it. Any questions? And these are all the references used within the presentation. And this concludes my presentation. I would just like to take the opportunity to thank, Vanessa from Chilombo Career Services, Keisha and Casey from DRD for providing an amazing learning experience. And of course, for everyone who listened to me speak today, thank you so much for your time.
Awesome. Thanks so much, Elizabeth. I'm always on social media, so we'll be following along and sharing from the many Chilombo accounts. Super exciting. Thanks so much. Again, if anyone has questions or comments, feel free to drop them in the presentation, or sorry, in the comments, and I will hand it over to Romae from Black Health Commission.
Thank you, Vanessa. Okay. Can everyone see the screen?
Yes.
Okay, perfect, because I can't see y'all. Okay, perfect. Thank you all so much for coming out this evening on this virtual world and listening to each of our presentations. My name is Romae, and I had the opportunity to work with Rebecca from Black Health Commission located in Orlando, Orlando, Florida. A little bit about me. I recently just graduated with my MPH from the University of Florida, and I focused on social and behavioral sciences. So this opportunity gave me the perfect arena and the perfect space, the perfect environment for me to literally use all the program planning, all of the work that comes into making a community project and comes into uniting and promoting community health. So the title of my presentation this afternoon is Community Engagement is a Full Movie Production, and hopefully the message gets across. So when we talk about Black Health Commission, for those of you new to Black Health Commission, it's a nonprofit organization whose mission is to educate and bring awareness on the root causes of health disparities through volunteerism, community-based programming, and collaboration with other organizations. Through the time that Black Health Commission has been around, there has been many staple events in the Orlando area used to promote the community, specifically the Black community, and to unite the Black community in that area. So for example, some events, It Takes a Village, a community baby shower was an event used to bring joy, love, and awareness, to show appreciation for Black mothers and Black fathers through the time of pregnancy, and also being able to unite them and bring them all together for a time of joy. We Got You, Bro, and We Got You, Bro was a time for Black men to utilize and to voice their opinion for mental health awareness in the community. And then Yoga at the Park was a way to unite Black individuals in the area in order to, again, gain more attention and more awareness to mental health, and also utilize yoga as a way to release any type of stress or to really bond individuals together. I do have this QR code available for anyone interested in viewing the Instagram page for Black Health Commission. That's where a lot of interaction is received for the organization. So if anyone is interested in checking that out, that would be cool. I used a lot of the Instagram to get in contact with a lot of our partners and a lot of our volunteers that we have for a big event that's coming up soon that I'll talk about shortly. So this big event that I've been working with Rebecca and the entire Black Health Commission team is called Black Joy Festival, which will take place in about 2 weeks at Blue Jacket Park on August 28th. It's really a day to bring together joy, to bring together community, and to unite individuals, Black individuals in the Orlando area to this park where we'll have different vendors, we'll have a kids zone, we'll have an opportunity to have a photo booth section, we'll have music, we'll have games, there's a yoga part associated with Black Joy Festival. And the real essence or the real premise of why this is happening, it's an annual fundraiser for Black Health Commission to continue the community initiatives. So to continue all those staple events that I just mentioned, and to continue to spread joy and to spread awareness for our community in order to continue some of the impacts that we've had and that we will continue to have moving forward. And moving forward, so in order to have Black Joy Festival be alive and to be as best as possible, we have to get the community involved, and we have to reach out to resources in order to get the impact and get the sustainable effort that we wish to see. So with that comes partnerships and getting sponsors and getting different organizations and different companies to see the vision for Black Joy Festival, and also to help us bring it into into life, basically. We have different levels of sponsorships and partnerships available for different organizations. And I've learned about this a little bit more through Tracy Brown. She has an organization called Urban Awareness, and I've watched a couple of their webinars talking about sponsorships, in-kind sponsors, how to gain those type of financial resources, and how to include the mission of the nonprofit with the mission of the organization, the type of language to use, the timeline, what to look out for, which has taught me so much because in my time during the internship, I've learned how to fill out successful partnership requests and how to speak with different representatives from different organizations in the Orlando area in order to gain the level of partnerships that we do have. So right now we have secured a few partners, and we're looking to gain more. But it was interesting for me, because my background is in social science, but it's interesting to me to learn more about the policy side, learn more about how local governments operate, different individuals who work in the local government and their role and the type of resources that they have to utilize in order to secure and to confirm the type of sponsors that we have for Black Joy Festival. And one of the main projects that I worked on throughout the internship was this resource guide. It's a resource guide for people who who will be attending Black Joy Festival, and for individuals who are interested in looking at Black mental health and the type of resources available specifically in the Orlando area. So I included another QR code for anyone who wants to look through this document. It's a few pages highlighting COVID safety. We talk about mental health stigmas in the Black community. We talk about business and resources in the Orlando area. So we talk about Black therapy in Orlando. We talk about Black businesses. We talk about Black podcasts, anything to uplift the Black community and to be a resource guide for the community at large. And then we also shout out the Black Health Commission Board and the steering committee, who has worked entirely hard this entire summer to bring this event to life, and also help me to edit and tweak the resource guide and the type of information that we provide in the resource guide. So if anyone wants to check it out, be sure to scan the QR code on your phone, and hopefully you can utilize some of the resources that is on there. And then we talk about community engagement. Another key piece of what I helped Rebecca and the entire team do is gain volunteers and also work with different vendors in order to have the large community impact that Black Joy Festival aims to have. So I contacted many organizations from the UCF area, or the University of Central Florida, and we have over 25 volunteers specifically from the school, and 30 and more volunteers from the local community, whether that means local businesses or just supporters of BHC in general, which is really cool for me to see, because in a time like this, where this is the first summer that everyone is really reclaiming their time, it was cool to see that many organizations on college campuses were still wishing to gain volunteer hours, or wishing to support nonprofits and to support the Black community and what Black Health Commission is doing. So it was cool to see that when I was reaching out to these different orgs, they always came back and they had more members wanting to volunteer, or they had more questions. They wanted to promote it more to the bigger audience of the school campus. So that was cool to see. And another cool thing that I did was I created social media posts for our different committees that we had for Black Joy Festival. So there's a corporate relations and sponsorship committee, a vendor committee, and a guest experience committee, amongst many more. But it was cool to see different individuals use their strengths to play key roles and to lead these committees in really cool and unique ways, which is how we ended up getting many vendors throughout the area, and also unique vendors that want to promote unity and promote joy, which is what Black Joy Festival is going to be all about. And then also a huge shout out to our steering committee. It was actually my first time being a part of a steering committee, which was cool because being in school, I took a class about program planning, and we talked a lot about the steering committee and how important the steering committee is to an event or to a nonprofit. And it was interesting to just see it come into full life. And it's like a full moment circle for me to see all these talented and unique individuals come together in a space and talk about the branding of the event and the impact the event can have, and the monumental experience that they want guests to have at the event. And it was unique to also connect with the health department and to ask them, how they could provide COVID safety for the guests that's planning to attend Black Joy Festival, and also any other updates that they would have in order to keep everyone safe. So it was nice to see that even, when everyone is very cautious about things that are going on in the world, that they still made an effort to want to continue in community engagement and continue in community unity. That was cool to see. And then as far as professional development, as I kind of wrap up my presentation, I've learned a lot about professional development through this entire internship process. Seeing that I just graduated, I was very curious, and I was very excited to learn more about what I can do with my public health experience and how I can utilize the curriculum the classes and curriculum that I took to really brand myself and to put myself into places and environments that will give me a challenge. So, with the help of Vanessa, I did sessions with her about my resume and cover letter language, and I was applying to different internships while I was still a part of BHC, which was cool for me to see myself think outside of the box and also to challenge myself to venture out of the typical program planning or community engagement that I studied while I was in school. I also learned about the CPH exam, which is the Certified in Public Health exam. I learned about different resources that I can utilize to study for the exam, which I plan to take later in September. And I also have plans on creating a public health blog. I think for me, being a first generation college student, it was interesting to go in public health, but also interesting to see that many of my peers did not know the depth of what public health does in our society. And I'm interested in creating a blog targeted for college students to educate them more on how public health works into their everyday life. And then as far as program planning and development, I highlighted social media engagement with BHC. We contacted many different organizations, and we made many posts about Black Joy Festival and how followers and how supporters can get involved. I talked about creating the social media content and also marketing and promotion for partnerships. So making sure that all of the goodie bags and all of the advertisement that we have for Black Joy Festival included all the sponsors, and gave the sponsors what they were looking for that we presented to them in the program proposal packet. And then as far as nonprofit development, I appreciated this a lot because we also, as scholars, we have the opportunity to have a session with a woman that talked a lot about nonprofit development, and I learned a lot about the language themes and partnerships and vendors, city operations, promotional items, and a nonprofit board, which Rebecca and I talked a lot about how to create a working and sustainable nonprofit board, and also how to understand the city and how city regulations and city policy work with your nonprofit. And that will pretty much wrap up my time with Black Health Commission. I want to thank Rebecca. I want to thank the entire Black Health Commission team, and also Chilombo Scholars for allowing me to have this time and opportunity to branch out and to continue to stay engaged in public health. If I have my name on LinkedIn, if anyone wants to connect, and I'm also open for questions if anyone has any. Thank you all.
Awesome. Thanks so much, Romae. Very informative. And I've been keeping up and seeing all of the posts. Wish I was on the Florida side of the world to attend. But yeah, it's really, I'm just as each of you are going, it's really exciting to see that all that you've been able to do in a short amount of time and the support you have on your nonprofits. So next we have Kendra, who will be sharing about her experience with Project Life's Journey.
Good evening, everyone. While my screen loads up, I'll just introduce myself. My name is Kendra Hester, and I'm actually finishing up my MPH at GW. I'll be completed by December, and my site was Project Life's Journey. Can you all see the presentation yet?
Not yet, but if you'd like me to present, I'm happy to on my end if it's, and then you can just, did you see the bottom arrow?
Yeah, I think my computer's frozen.
Okay, no problem. Do you want me to go ahead and present and then you can let me know when to navigate or?
Yeah, sure, we can start.
Okay, let me see if I can get, let's see. Okay, I'm in the same version of the presentation you're in, so let me see if this, okay. Can you all see?
Yes.
Okay, great. I'll hand it over to you. Just let me know when you need me to.
Okay, just so you know, I cannot see it yet. I'm still frozen, but I'll just let you know when to go to the next slide. Okay, so that's my intro. You can go to the second.
I think she might have dropped off. Wait a minute. All right, we'll wait maybe about 2 more minutes and then might jump over to Brianna if we're still having technical difficulties. All right, Brianna, I think I'll go ahead and have you do your presentation.
Okay.
Because I think, yeah, maybe in the interest of time. So let me stop presenting on my end and we'll hop to you.
All right, good evening, everyone. Thank you for joining us. My name is Brianna Hanson, and I'm a 2021 Chilombo Scholar. This presentation is entitled Something to Chew On, an overview of the Food for Thought digital campaign. Tonight, I'll be walking you through my summer as a Chilombo Scholar. This summer, I worked with Millennials for Environmental Justice, also known as M4EJ. M4EJ is a nonprofit organization founded in 2019 to inform, engage, and advocate for environmental justice among communities that suffer disproportionately from adverse health, social, and economic outcomes associated with the neighborhoods in which they reside. M4EJ has 4 pillars: environmental health, community, urban planning, food security, and economic development. This summer, I focused on M4EJ's food security pillar. I brought awareness to food insecurity because it's a health issue that disproportionately impacts students of color. I was responsible for conducting literature reviews, presenting my campaign ideas, working to create a project plan, and monitoring an evaluation plan, as well as building partnerships and collaborations. Diamond, who's the founder of M4EJ, was a critical piece of my project by providing feedback and support at all stages. I'll now walk you through my project plan. So I came up with this very clever title for the campaign. I really wanted to catch people's attention and have a play on words. So it was called Food for Thought, Confronting Food Insecurity Among Black and Brown College Students. The purpose of the Food for Thought campaign is to increase awareness on the prevalence of food insecurity among Black and Brown college students. When planning, I set 3 goals. 1, reach a combined total of 1,000 impressions on Food for Thought Instagram posts. 2, receive views by 25% accounts that were not following Millennials for Environmental Justice across all Food for Thought Instagram posts. 3, reach 30 unique visitors to the Food for Thought Wix page. And I plan to achieve all of this by August 9th, which was my last day as a Just Health Fellow. And from this campaign, I expected more Black and Brown students to be aware of their likelihood of being food insecure during college and graduate professional school, increased knowledge and availability of resources for food insecure students, more U.S. colleges and universities involved in efforts to decrease food insecurity in their student body, enhancements of the public's awareness and actions towards combating food insecurity among students, and the development of partnerships with institutions and organizations. So the digital campaign consisted of 4 parts: a web page, social media campaign, Zoom series, and partnership. So here's the Food for Thought webpage you'll see on the screenshot below, and the link to it is up top. So I created, designed, and updated the Food for Thought webpage throughout the summer. The page went live on July 1st, 2021. And I had previous experience with working with Wix, so I was familiar with the platform and how to maneuver and create a webpage. And everything related to my campaign is found and housed on this website. On the Food for Thought website, you'll find 2 spotlights. One is of Deandra Cameron, who participated in one of the Zoom sessions. Her spotlight consists of a video of her reflecting on her experiences helping fight food insecurity. I also highlighted New Brunswick Community Farmers Market, and they were also part of the Zoom series. Lauren, who's on the executive committee, gave viewers a great overview of all the wonderful work the farmers market does. And she recorded the video before she was a panelist. This way, our audience could have some background information on the market before tuning into the Zoom session. Also part of the farmers market spotlight, I included photos I took when I went to visit the farmers market. This was actually one of my favorite parts of the summer because I was able to see firsthand the amazing work the farmers market does, how they really impact and serve the community in which they reside. And it was also exciting because I was able to combine my photography skills with my passion for health equity. And while I was at the farmers market, I actually recorded some videos that were later turned into an Instagram reel. The social media campaign kicked off on July 9th. and I used sources like USDA, Feeding America, and PubMed to conduct a literature review on food insecurity. Once I felt confident in the information that I gathered, I then went through and pulled out what I thought would be most beneficial for the audience to know. In order to set the stage, I first gave a basic definition of what food insecurity is, which is having little or uncertain access to adequate food. I next thought it was important to highlight the problem as well as the disparity in food insecurity, because although 1 in 5 undergraduate and graduate students are food insecure, Black and brown students are more likely to be food insecure. So followed by that statistic, we included a chart that actually breaks down this disparity by race and ethnicity, and it really served as a great visual for this. The post also included some important information such as the health impacts of food insecurity and an overview of some of the causes like poverty and other examples of systemic racism. The collection of infographics was posted on Instagram, LinkedIn, and Facebook. And for me, it was very important for this to be the first food for thought post because I really wanted to get the audience aware of the issue and get them geared up for the rest of the campaign. So in order to end food insecurity, we literally need all hands on deck. So that means individuals, families, colleges and universities, nonprofits, and more all have to be involved so we can eradicate this on college campuses across the nation. So the solutions post highlights the need for collaboration to end this issue, and it gives a few sample actions and solutions to help. So some of these I thought of on my own or found them through the research I did. And for some of the solutions, there's an asterisk. So we recommended that viewers check out the Shared Humanity Project's website to view guides that aid in ending poverty. And this post went up August 9th. So the bulk of my summer was spent planning and preparing for the Zoom series featuring thought leaders from the Garden State. Because of the short timeline, I relied on my personal and professional network because I knew I could get a fast turnaround and also just better chance of participation. So after selecting and inviting the panelists, I created the promotional materials. These were shared across social media platforms, email listservs, word of mouth, and we also encouraged the panelists to share the flyers with their network as well. Then created an agenda for each of the panels because personally, I just needed to make sure there was some type of structure and flow for each of the events. And I also worked on creating the interview questions, then collaborated with Diamond to select which were the best ones to ask the panelists. I also created a Zoom link, so individuals had to register beforehand, and that was helpful because I was able to track attendee information. And my role for the actual Zoom session was to moderate and record the sessions. After the sessions, I uploaded the video onto YouTube as well as the webpage. And all of the attendees received an email afterwards with a link to an evaluation as well as a link to watch the recorded session. And then after the sessions, I clipped answers from the panelists and posted those on the Instagram story to serve as a recap and also a little sneak peek for people who weren't able to make the Zoom session. So for the series, the panelists were food security activists, a person with lived experience, professors with research experience, and organizational leaders helping in the fight to end food insecurity on campus. The first panel included college alumni, then we had one with professors, and then the third one was combating food insecurity from an organizational approach. And I individualized it this way to provide synergy within the panel, but then throughout the entire series. So by watching the entire Zoom series, someone will walk away with understanding food insecurity at the individual, interpersonal, organizational, community, and policy level. So as I mentioned, our solutions post pushed viewers to the Shared Humanity Project website to view action guides on ending poverty. The Shared Humanity Project puts thoughts into actions to end poverty, bringing together people of all ages, races, and backgrounds to work towards economic and social change. Doctors Mark Burgle and Captain Ross Phillips founded the organization after decades of work in both the provision and analyses of social service programs. Their combined experiences led them to believe that we need a new approach to ending poverty. The National Plan to End Poverty, which is the first initiative of the Shared Humanity Project, is a blueprint for this approach. So last summer, as a research intern, I reviewed, analyzed, and created action guides, part of the National Plan to End Poverty. And I felt that the mission and values of the Shared Humanity Project had significant overlap with M4EJ. So I contacted my previous internship supervisor, and we set up a call with her, myself, and Diamond to discuss a partnership. So now the Shared Humanity Project is featured on the Food for Thought webpage, and I'm really looking forward to seeing the mark that M4EJ makes on the Shared Humanity Project community. Now we're going to take a look to see how each of the components of the project did statistically. So on the left, you'll see the 3 goals that I mentioned at the beginning of the campaign. We successfully achieved goal number 1 of reaching 1,000 impressions on Food for Thought Instagram posts. There were a total of 1,059 impressions. Goal number 2 of reaching 25% of accounts that did not follow M4EJ was not reached. However, we were very close with 20% of accounts that viewed Food for Thought posts that did not follow M4EJ. And for me, this metric was very crucial because I wanted to see how many people outside of M4EJ's normal audience and following were viewing our posts. The last goal of reaching 30 unique visitors on the Food for Thought website was exceeded with 57 unique viewers. And although on the right, these weren't goals, I just wanted to highlight quickly some of the other amazing analytics. So on Instagram, Food for Thought posts reached 124 shares, 21 saves, and that's huge because that means people were spreading the posts out to other Instagram users as well as bookmarking it to view it later. Also, the Instagram reel that I mentioned earlier from the farmers market reached 5,858 accounts during its first 3 hours of posting. The webpage also has some really great metrics with 168 site sessions, 220 page views, and 30 minutes spent on the page on average. And the Zoom series had a total of 18 attendees with 21 YouTube views. The evaluation responses were a bit low, but the evaluation link is included on the webpage for people to complete after they've watched the archived version. So what's next? So I recommend M4EJ continue the Food for Thought campaign, as this is a really relevant topic that I'm sure many of us have experienced as a college student. So some activities the organization can consider when extending the campaign are a pledge for colleges and universities to sign that says they will end food insecurity on their campuses. M4EJ members said that they're working on this and actually plan to have it ready for the end of August. A fun way to get people to watch those archived Zoom series would be to host a scavenger hunt. So individuals could watch the Zoom, pull out information, and get answers for a chance to win a prize. And while the 3 original Food for Thought panels included thought leaders from New Jersey, it would be really great to expand on this. So other organizations, other thought leaders, and even current Black and Brown college students would be great to have included in this. Also, Food for Thought could be a home or to a resource guide with food support services on or near college campuses. So whoever starts on this initiative can start with their own college or alma mater and then expand to other ones across the nation. M4EJ can also advocate and encourage colleges and universities to track data on food insecure students on their campus. This is something that Rutgers University started in 2016, and it would be really helpful for other colleges to follow. So as the campaign came to an end, I was able to reflect on my experience and work this summer. So food insecurity is a silent problem. Students will often prioritize other basic needs like housing or school supplies over food simply out of necessity. So now that I'm no longer a student in academia, I want to be the voice for those who are underserved. So those who are going hungry often don't talk about being hungry or talk about their suffering. So I wanted to bring awareness to this topic to hopefully destigmatize the use of food support resources. The next is that project planning is key, and you have to have keen foresight. So developing and executing a plan is not easy. However, if you make the plan feasible and realistic, it can definitely be done. I had a lot of great ideas for the campaign, but in the end, I couldn't execute them all on my own. For the next project I work on, I definitely want to consider how I can incorporate other team or board members so that all of my ideas can be implemented. Also very important is to make sure you have a backup plan in case of any technology issues. And if there's anything, or just if you can take away one thing from this presentation, let it be this. Food security is racial justice. Without stable access to food, students are more likely to experience adverse health, social, and financial effects. For instance, food insecure students are more likely to drop out of school, Low educational attainment is often associated with low household income, and having a low socioeconomic status comes with its own struggles and barriers, especially as a Black and brown person already experiencing oppression. The moral of the story is, to ensure the future generation can live a fruitful and stable life, we need to make sure they have access to basic needs like food and that they're affordable. So I challenge each and every one of you to check out the Food for Thought webpage and find ways that you can contribute to the fight to end food insecurity at colleges and universities around the nation. And if you have any questions at all, feel free to connect with me on LinkedIn or you can email me. Thank you for your time.
Awesome. Great presentation, Brianna, and very informative. And as I said before, the social media engagement and work you all are doing is pretty amazing. And I've been following along. We'll continue to do so. All right. Last but not least, we'll go to Kendra. So if anyone wouldn't mind staying on a little bit longer, so we could hear about the great work that she's been up to this summer. And let me know if you would prefer if I would present or if you can on your end.
I'm just going to ask for you to present. I don't want to go through.
Okay, no problem. I have it still up, so I will pull that up.
And I'm not actually sure where I dropped off, but I'll just start in. Okay. So I was part of Project's Life Journey over the last 10 weeks. Okay. And the founder of Project's Life Journey is Benicia Hernandez, who actually founded Life's Journey as a means to aid in mental health and wellness and members of the Hampton Roads community. The Project Life's Journey nonprofit is actually a subsidiary, and they have a lot of the same aims, but it's actually to provide the services for free. And my goal during this time was to assist in an initiative that aimed at fighting the increasing incidence of STIs in the region that they serve, which is the Hampton Roads area. Next slide. So why are we taking on STDs? So the 2018 estimate for STIs was 27 million transmitted in that year. And those resulted in a lifetime direct healthcare cost of 16 billion. This includes all conditions like HPV, HIV, chlamydia, gonorrhea, and syphilis. This presentation will not focus on HPV and HIV, as there have been decreases in the rate of transmission in the state. HIV rate in 2016 was 15.3 compared to 13.1 in 2019. And the HPV rate has seen a steady decline due to the initiation of the HPV vaccine. Next slide. Okay, so the US trends show that chlamydia, gonorrhea, and syphilis has been increasing since 2015. We see 20% for chlamydia, 50% for gonorrhea, and 70% for syphilis. The charts that you can see below those is for Virginia. So you can see that Virginia follows the same trends as the US. So there's been increases for all genders. Next slide. The current Virginia demographic trends show that among the ages, the highest incidence is for those aged 20 to 24, followed by those 15 to 19, and those 25 to 30. Among gender, men make up the most cases, and they are 6 times more likely to get syphilis and 1.5 times likely for gonorrhea. The only exception will be for chlamydia, in which women had rates 2 times that of men. Disparities among race were even greater, as Black people had higher rates of all STIs than white and Hispanic populations. For instance, chlamydia was 6 times higher among Black people than white and 3 times higher than Hispanic. And then finally, the municipalities that make up the Hampton Roads area were part of the largest rates of growing STIs. Next slide. So based on the findings from the literature review, our target population would be Black adolescents and young adults between the ages of 15 to 30. And the locale would be the Hampton Roads municipalities in Virginia. The interventions would be aimed at increasing testing, treatment, and prevention of STDs and STIs in the region. And this is, again, a social media campaign. Next slide. And I do want to caveat that we have not implemented our campaign. This is simply the plan. The nonprofit is still in its early stages, so this is just the background work for them to actually implement. So youth and young adults have more access to technology and the use of social media for health promotion. So our campaign is tailored to the community and it's modeled after the Get Yourself Tested campaign, which is actually a CDC evidence-based campaign that is actually proven to increase engagement with adolescents and young adults around sexual health, especially in the avenue of increasing testing. This little chart that you see here is actually, this map that you see is actually the Hampton Roads regions. Next slide. So these are some of the potential barriers that we anticipate. And these are actually based on another program that targeted Black and Latino youth in California, but this is some of the barriers that they were able to find from using the Get Yourself Tested campaign and adapting it for their population. So insurance and confidentiality is one issue. So a lot of youth are relying on their parents' insurance, or their primary care providers are acquainted with their family. So that is an issue in terms of getting them to get themselves tested. Privacy is another issue. So the lack of privacy in the community-based organizations, or actually having sexual minority clinics where they could potentially be targets for stigma or any type of abuse, is additional barrier. Messaging stigma is often too focused on the sexualization of especially LGBT community, and it's also used as fear-based tactics. The perception of this was mixed, so our campaign is going to use some of it, but it won't be the complete campaign. And finally, the inclusivity. So some youth explained that they enjoyed messages that would target them, but other ones felt like it made them feel ostracized. So having a campaign that allows people to see themselves, but also not target them completely was ideal. Next slide. So this is just an example of some of the Get Yourself Tested social media materials. And the following slides will be the adaptation for the PLJ campaign. Next slide. So this is actually modeled after the Virginia is for Lovers slogan. So like I said, it markets the Get Yourself Tested campaign. So as you can see, it doesn't mention any type of sexuality, and it just says anybody who's sexually active. Excuse me. Next slide. These two actually give a depiction of what the data looks like in a way that could be more digestible for people in the age group. Next slide. And we did want to make sure we did have some inclusion of the LGBT community. So we did have one one graph that we'll be able to use in terms of engaging that part, but we also want to make sure we engage heterosexual and anybody who's sexual in general. Next slide. Finally, I did develop a logic model that they'll be able to use as part of any grants or any type of community partnership that they're aiming to include as part of their social media campaign. The goal is to use a lot of the resources that Life's Journey, which is, like I said, the main agency that they already have to continue to make those connections in the community. It's good that they already have a footing in the community. They've already initiated two but they've had two fundraisers where they were able to get a lot of interaction in the community. One fundraiser actually had 1,000 participants, and that was actually during COVID. So I definitely think that we have a lot of potential in terms of reaching a lot of youth. And next slide. And the way we do aim to do that is through the use of 4 different social media. So for TikTok, we plan to have dances and songs to create educational and resource-driven videos. I did submit a couple scripts that they can use to actually start what those videos will look like. Excuse me. And that will be for those aged 15 to 19. For those in the 20 to 24 age group, we're going to target Instagram and Facebook to use imagery and posts to provide education and increase engagement with the local resources. And then finally, those ages 25 to 30, we're going to use Twitter in order to actually get some of that interactive messaging. Now, I do want to say that anybody in the target population can be engaged in TikTok, Instagram, Facebook, or Twitter, but just based on usage, these are the targeted age groups. And next slide, these are my references, and that is the combination of my presentation.
Awesome. Thanks so much, Kendra. Very informative, and it's great to see the research focused side of things and how that feeds into the messaging of your campaign. So awesome job. So wow, we're right at 7:30, so I won't keep you all for much longer, but I just want to say amazing job to everyone. I mean, not just the content of what you're presenting and the thought that you all put in, and clearly, I mean, I'm glad that you all were able to do so much in 10 weeks and learn a lot. But on another note, you all have just very visually pleasing and amazing slides. So that was just wonderful to see. So yeah, thanks so much. Amazing job. Congrats on finishing the Chilombo Scholars Program. And thanks so much to our nonprofit leaders for your support from the beginning of when we were bothering you about applications all the way till now. Can't believe we're at the end of the program. I'm dramatic about everything. So, you know, definitely celebrating. So I hope you guys all celebrate. You'll be getting, again, one more email from us, quick survey, and then your certificates of completion. And as mentioned, scholars, please do reach out if you would like any last group and or individual coaching call. I know many of you have just finished school or are finishing up your MPH program or even kind of delving into it in the next year. So a lot of transitionary periods, and want to be able to have continuous support for you all. But thanks so much, everyone. This again is recorded and will be on our YouTube channel probably by tomorrow. So be sent out to everyone and you'll be able to share. And also we'll send out the presentations directly so that you all have those as well. So that's it from me. And I also just specifically want to thank I thanked, the people involved in the program and the sessions, but I also want to thank a couple people on my team who've done a lot behind the scenes to get things going. So the first being Tosca, who's the operations coordinator. I believe she's on the call, who's really just, when she jumped in working for Chilombo for a couple of months ago into helping with the communications and survey development, and really just helping plan this session today. So thanks so much to Tosca. I also want to thank Amma, who is working as outreach and comms. She did a lot when it came to setting up many of the Chilombo events, specifically this one, and helping kind of going back and forth to make sure that we got all the content and information. And then lastly, I also want to thank my summer intern this summer, who's been working full-time for Chilombo on social media and research. So really all the flyers and all of the communications that you see have all been her work. So yeah, it definitely takes a village, as we see with the work you all did at your nonprofits. Super grateful for everyone who's been involved in this. And yeah, everyone, please do stay in touch. Follow Chilombo Careers on all platforms, except we're not on TikTok. And yeah, thanks so much, everyone. And please do follow up if you have any additional questions. Feel free to email the Chilombo email, which is programs at Chilombo Global Career Services, if you have any additional needs. And yeah, I think that's it on my end. And just thanks also to everyone who attended, but I see some other people that are on the Chilombo team as well. Amaka, Shauna was on here earlier. So yeah, I appreciate everyone taking time in their Thursday evening to support these scholars. So yeah, really proud of you all. Great work. And thanks so much. And we'll be in touch. All right. Thanks so much, everyone. Have a good one.